So you talked about the multi-day inspection, and I think one of the things you talked about was the importance of basically having like a not a closeout, but certainly a summary of the day's
Mhm.
activities towards the end of the day. Any other things that we should be aware of as it comes to dealing with multi-day inspections?
Sure, sure. One of the things I always recommend is that we have someone who is kind of the host of the audit, but we also have someone who is a scribe or a note taker. It's very difficult, I find, to answer questions as well as taking complete and thorough notes. And these people can change roles during the day. But you want to make sure you have a complete note taker as well as someone who's answering questions. You may also have subject matter experts that you pull in to answer questions on, say, a specific process or a specific test method, or those types of things. At the end of the day, especially if it's a multi-day inspection, I like to summarize how that day's audit went. So taking those notes from that day's audit and just kind of writing up a couple of paragraphs. Why do we do this? Because when you get to remediation, looking back at who said what, who responded in what way, what documents were presented to the FDA, having those notes to look back on is really critical. Because especially if it's a week or more, trying to think back on what was said and who said what is really a difficult task.
Awesome. Thanks for that. So as we think about the end of the inspection, other than maybe heading to our local watering hole for a drink when the inspection's over, what's going to happen at the close of the inspection? What should we do once the inspector leaves the building? Anything we can do sort of right there post-inspection?
Sure, sure. So the way the inspector closes the inspection, they do a closeout meeting. And generally, um, companies like to invite most of their key players to that closeout meeting so everybody can hear what the FDA has to say. Um, the FDA doesn't really expect you to respond during that closeout meeting. They just want to cover if they found any out of compliance situations. They'll present you with a 483, and this is basically just a list of observations. And so they basically, list, it's like an audit report. They list it in the document and present it to the highest, it might be the president or the CEO, whoever is the highest level person at the facility. So that's kind of how the inspection closes out. And then the industry expectation is that within about 15 days, business days, you respond to those 483 items with a corrective action plan. So sometimes companies miss the mark with this one. They either try to respond to everything while the FDA is still on site instead of focusing on really answering the questions for the FDA. They think it makes them look more professional if they get everything done right then, instead of taking the time to really do a good job of remediating. Or they don't respond, which can also harm you as well. So the FDA really wants you to do a thoughtful response, come up with an action plan, and respond in writing to that 483. And they usually provide you with who to respond to and how to respond. It's usually via email.